Good evening, everybody. I'm Stuart Woolley. I'm the paramedic practice leader in clinical and professional practice. And thank you for your time this evening. I just wanted to share a quick video to walk through some of the Siren changes that are going to occur through May 2024. These are going to go live on May the 1st, 2024, and they specifically impact the assess, see, treat, and refer options we have in Siren. Before I do move on, I just want to recognise that BCHS provides services to thousands of patients on a daily basis on traditional, ancestral, and unceded and ceded territories of First Nations all across British Columbia. And thank you for the work that you're doing supporting our communities. Tonight, I'm joining as a grateful guest on the traditional, ancestral, and unceded territories of the Chiam, Stahelis, Skrailet, and Seabird Islands people in the Eastern Fraser Valley, where I'm a grateful guest and just so grateful over the past couple of years to witness the land change as the seasons developed with us. So thank you for everything that you do, responding all around British Columbia. So on May the 1st, 2024, you're going to notice some changes come down the pipeline with Siren. This is part of the quarterly Siren sprint. We do this a couple of times through the year. However, specifically on this update, there are some changes to the ASTaR and low acuity initiative pages that we have. This is as a result of probably a year's worth of work and research and development into how we can really redesign what we're doing and get some upkick in the ASTaR pathways throughout the service. So some of the biggest changes that you're going to see when you log in is, first of all, there's going to be a redesign of the ASTaR page in the patient disposition to capture the referrals where patients are either conveyed or referred on to other services. We know that we have pathways here where a patient can be referred into a pathway and not conveyed and left at home, and alternatively referred into a pathway and conveyed into that centre, for example, an urgent care centre, or in inclement weather conditions, we can convey patients to either a warming centre or in the summer, a cooling centre. So we're now having the ability to capture all of these patients within Siren, where previously it was a little complex to get the information correct for us. Additionally, you're going to see a new ASTaR qualification form, and this is going to be prompted relatively early within the PCR completion stage for CRM yellow events. This is not going to impact and be relevant to IFTs, into facility transfers, and it's not going to be relevant to community paramedic services, which may sometimes trigger a yellow event, depending on how we capture that within CAD. This is specifically for 911 out of hospital events. Where we may have an opportunity to capture a patient into an ASTaR pathway and refer them into an alternative destination, or provide some other unscheduled care for them when they probably don't need an emergency department. So the ASTaR qualification question page, as mentioned, will be coming through on certain CRM yellow questions. It has some options available to you, and the first question is really straightforward. Does this patient qualify for an ASTaR clinical pathway? Very simple, yes or no. If the patient doesn't qualify for a pathway, we want to try and figure out why. Where are we missing the gap here with them? So there's some options you can check. Either the pathway is not available in your area, the age of the patient, they're either too old or too young for the documentation that we have already. Does their news score disqualify them or contraindicate them is probably a better term for an ASTaR pathway, and it helps us judge the level of acuity of that patient. And then on the other side of that, we've got the vital signs. Are there other trends in the vital signs that maybe don't allow us to use an ASTaR pathway? You have the ability to either simply select, for example, vital signs, or if it's not in your area, you can type in some notes for us, and it will help us understand what's happening around BC with pathways. This is an overridable question, so you will be able to override it to finalise your form. However, I'd be really grateful if we can start and use this as much as possible so it can help us get some information and data and try and make the services easier for you to navigate and try and break down some of these barriers. One of the other big changes that you're going to notice is on the clinical pathways page within the patient disposition section. So this is the current view that you can see with the ASTaR clinical pathways. We're going to rearrange them into alphabetical order, so it's much easier and quicker for us to identify where we're going with these patients. And additionally, we're going to rename some of them to reflect their applicability. As an example, hypothermia Earlier in the year, that was hyperthermia, and then due to the inclement weather, I very quickly had to develop a new pathway and change that to hypothermia. This is now going to be along the lines of an environmental emergency to capture both cold emergencies and hot emergencies in the summer and winter. And then that will also reduce siren changes for yourself, because we know that there's a lot of changes that happen throughout the year. So that will be reorganized on your screen. So why did we have to do these changes, or why did we want to do these changes? As I mentioned, over the past year, myself and Kayla Wellwood, the low acuity manager, has been working very hard behind the scenes to try and see where the gaps are within the pathways, and to help us understand why they're not being utilized as best as possible, and some of the barriers that paramedics face. And we've had lots of feedback, which has helped us design this. As mentioned, we know that they're underutilized. We have the pathways available to us, and we have the calls that are coming in via the 911 system that could possibly be redirected into alternative pathways. But to allow us to actually really capture some solid in the moment data, this is going to be a really valuable tool to us. There's 5 things that we're really looking for. We want to find out the barriers for implementation. What is stopping you as a paramedic using an ASTaR pathway? Is there any missed opportunities for patient referrals as well? So are we seeing patients who are conveyed to an emergency department that could have been taken into an urgent care centre or an alternative pathway, that we maybe don't know if that's in your area, or there's some other barriers to that opportunity? So it allows us to capture that as well. Looking at assessments to referral criteria, do we need to adapt and alter some of the assessments that we capture within the criteria to make them easier? We know over the last year we've introduced the generic inclusion and exclusion criteria for urgent care centres, and we've slowly seen an increase in figures going into urgent care centres as a direct result of that. So we want to see how we can impact this on other ASTaR pathways to us. Again, regional availability is a big factor. We know that there's some areas in BC that have different pathways to others. So we want to capture some missed events there to help us maybe contact regional partners and health authorities to see if we can build on the relationships that we have. And again, looking at opportunities to develop better education for paramedics and support tools for paramedics, the crews that are using these on a daily basis. We want to make it easy, understandable, build confidence in using them, and be in a really good position to assess, see, and treat these low acuity patients in their unscheduled events that present to us in the 911 system. If you do want some more information, there's a low acuity and clinical hub section on the BCHS intranet, which has some more information about all the ASTaR pathways. And there's an information series in 4 sections, which breaks down the low acuity initiatives in much more details. So the first issue was launching the new LaRue guide, the link and referral guide. That was formerly known as the low acuity response unit. Issue 2 is looking at the clinical hub and the LaRue program's expansion and the importance of low acuity care. Issue 3 is really the clinical hub in action, ASTaR pathways and alternative destinations, and seeing the massive impact that our clinical hub and the secondary triage clinicians have on a daily basis with patients. And then issue 4 is looking basically, what do you want to know about clinical pathways? What do you want to know about low acuity care? And there's much more information in there that you can log onto the internet and have a read. I'm sure you've got much more questions, many more questions that you want to ask us. If you have any ASTaR specific questions, please don't hesitate to direct them to Clinical Hub at bcehs.ca, and one of the Clinical Hub teams or myself will be able to get back to you and help you navigate that question. For general clinical practice questions, as always, you can direct it to clinicalpractice at bcehs.ca. That specific inbox lands with myself and my paramedic practice leader colleagues, and we'll be able to get you some feedback and answer your question. If you do use any of those questions, those email addresses, please do, wherever possible, use your BCEHS email address. That way it avoids the email going into the junk and spam inbox. Sometimes we'll miss it in there. Hopefully these changes won't impact your workflow too much. I know that Siren changes often involve a lot of changes. Some of these changes are in the back behind the scenes with the software and fixing some bugs, and then there's some pretty significant changes. But a lot of these are also driven by clinical practice and feedback from paramedics. So I'm hoping this is going to have a positive impact in the future of what we do with low acuity patients. As always, thank you for everything that you do. Please look after yourselves, stay safe. If you're off, enjoy your time off. Spring and summer is very rapidly approaching, so please do look after each other as the weather changes and it's starting to get warmer. And as always, any questions, please don't hesitate to get in touch. Take care.